Ooh, got a shimmer. Okay.
Hey everyone, Dr. Sonia here with Dr. Heather today. Welcome to Women Ignited. So this is a series that I wanted to create so that we can talk about things that affect women specifically and look at different things that we can do every day, the foundational pieces, and also looking at the bigger picture. So today we're going to be talking about pain and the different things that we can do to alleviate pain. And as we know, it's human nature to want to move away from pain, whether it's emotional pain, physical pain. However, throughout our lifetime, there are many times where we are faced with it, whether it's an injury or it's after birth, something that's so miraculous and great, but there's side effects from that experience. So today, Dr. Heather is going to talk to us about her experience in working with her patients and also just some foundational pieces that she knows work for women. So thank you for joining me.
Thank you for having me.
Yeah. So maybe start off with what you see with women, and particularly when it comes to injury and pain, and maybe some common themes that you've seen women deal with.
Right. So men and women definitely have different ways in which they deal or come up with injuries. And one of the main ones for females is during ovulation, which is part way between when they start their period and when their next period is at ovulation time is actually a time that women have more ligament laxity, and there's a little bit more give in their joints and ligaments, and that can actually lead to a greater risk of an ACL or any kind of ligament tear, just due to different hormones increasing in the body around that time.
Yeah, and I can really resonate with that too, because even during pregnancy, when there's more relaxin in the body, we're more prone to injury and like overextending, like you were saying too. So it makes sense that during our cycle that these themes would kind of show up.
Absolutely. Yep. And hormones play such a huge role in how our body handles different stresses. And yeah, around ovulation, that's definitely one where there is more laxity and more ability for injuries like that to occur.
hmm So what are some other things that you've noticed with pain? So, be it like we were talking about in the beginning, emotional pain that sometimes manifests as physical pain. Have you ever seen that connection?
Absolutely. There are some times where just because when we're going through an emotional reaction, that does cause an increase in cortisol, which is our stress hormone. And that can actually cause more inflammation in the body. And that inflammation can lead into feeling pain in specific areas of the body, especially if there's been a previous injury in that area or it's an area of weakness. And I don't just mean like a weak back or a weak shoulder, but it can also just be in like the muscles and how that cortisol and inflammation is affecting that area
hmm
and leading to a pain response, because our brain responds a lot quicker to pain than to other hormones and other reactions of the body.
Absolutely. And so, what do you think about nourishment and nutrition when it comes to pain? Are there certain foods that people might be eating that are aggravating pain, or are there certain foods that we should be avoiding? And have you seen that in your practice?
Yes, absolutely. Nutrition is such a huge factor in how pain and how the body responds to pain. So if people are having inflammatory foods or foods that cause more inflammation in the body, that could be anything from alcohol, simple sugars, fried food, like not good quality vitamins and good quality fats. Those all lead to more inflammation in the body, which then also is going to lead to a greater pain and a greater pain cycle as well.
hmm Yeah.
The cells don't end up healing as well in that area either, or when there isn't good nutrition. And then that can also lead to an injury taking longer to heal, which then perpetuates that pain cycle.
Right. So then what is good nutrition? Like what are some things that you can add to your diet that will help either reduce that inflammation or just general healing for that pain cycle?
So water is a main one, making sure that cells are hydrated. In regard to nutrition, good quality, dark leafy greens. If you're eating the colors of the rainbow, that's kind of a good way to kind of view it on the plate. Making sure that you're getting those like good quality fats, protein, which helps in repair and building of muscles and ligaments, because our body does continue to have stresses even just on a daily basis, which cause little wear and tear in the muscles, and that needs to be built up again. So lots of veggies, lots of good quality fruit and veg, decreasing those simple sugars, and getting lots of hydration.
You know, one thing that you're really great at is looking at an individual's posture and how that would be affecting their overall, whether it's their mindset, because, you know, it's giving different signals to the brain, or it's how they feel about themselves, or even like the general pain cycle that we may be feeling. So what are some things that you've noticed in women that may show up over the years, whether it's after giving birth, or even as a student, or even as someone that's working at a desk? Like, what are some things that show up for people?
Yeah, so women in particular, I notice a lot of like the rounded shoulders, and whether it be from like a lack of self-confidence, whether they're trying to hide if their breasts are bigger. A lot of women will kind of hunch over either because their breasts are large and it's more weight on their front, or they're trying to like retract in and almost like curl up so that they're not standing as tall. That's one. So self-esteem. It could even just be like a lack of shoulder mobility or strength to like pull those shoulders back. Some of it can be, other body image issues, or if a woman is really tall, they may try to slump forward in order to almost, make them seem less tall.
And I think that's huge for confidence. You know, there was a TED talk that was great, and it really talked about these postures, and it's something that we teach in yoga too. If you do these powerful postures where your arms are out and your shoulders are back and your chest is up and you're really expansive and open, it creates this other cycle with your brain where it's feeding it this information that, you know, one, you're worth it, one, you're confident, and your body is like retraining your mind. So if every day we're walking around with hunched shoulders, it's like we're hiding ourselves, and that in itself will perpetuate a cycle of pain, because now your physiology and your biology and your like muscles and bones and everything have to conform to that belief that you have about yourself. So I think posture is huge, not only for women but for everybody across the board, and children today with their like text neck, right? All of us with our text neck. We have to shift that to just, you know, that link between that postural stuff and how we feel about ourselves is huge.
Absolutely. And it all ties in. It's not just from an injury or pain like that. It's mental, it's physical, it's emotional, and it's spiritual. Just being able to, and all of those tie in together. And that's where we see that like chronic pain cycle happening, is there may not actually still be an injury in that area, but if the brain and the mind and the body aren't in alignment, the brain still is sending those cycles as in, hey, this is still sore even though it's not.
Yeah.
So.
Yeah. And I can really resonate with that. You know, I've been after having my children, and when we're breastfeeding, you're always kind of hunched over, or they're on your one hip and you're kind of leaning to one side, and you just naturally start moving through the world in that posture, and how much that has an effect on what you feel about yourself, even after having a child, right? There's already so much emotion that shows up, and so many beliefs and expectations that we have of ourselves, that our body will just go back to the way it was so very quickly, and then throw in some of that postural emotional stuff. It would take some time to shift out of that if we don't become aware of it.
Yeah. And you're totally right with the breastfeeding, because you're in that position, you're not moving as much, you're keeping that sleeping baby asleep for you. It's huge. And usually people don't have the best posture when it's in the middle of the night and they're feeding their baby and they fall asleep, and they're just trying to also, get some sleep themselves.
Yeah. So what are some things that women can do at home to alleviate pain, or to prevent pain, or to manage what's going on for them?
So definitely movement is so key, because it's getting it's getting circulation with giving good nutrients into the cells and into the muscles, and being able to take out what no longer is needed and what are considered waste products. So movement is key. It's going to keep flexibility in your joints and ligaments. It's going to help muscles not get into a stagnated or like stuck state. and full ranges of motion, right? Like if we're only moving in a specific range, our body then gets used to that and we're not able to move out of that range. So doing out of range yoga is great, stretching, exercise, going for a walk or a run, and moving in different positions, not just like front, back, side to side, but adding twisting and moving.
Dancing.
Like dancing, exactly. There's been a lot of that recently.
Yeah, good.
That can be one thing. Weight training is super important just to build up muscle and strength, and important to stretch as well. So like either going up against a wall and like getting your shoulders, I actually have a wall behind me. So like shoulders and neck. So back of the head, back of the shoulders, and then tilting the pelvis even to get your whole lower back against the wall as well.
So how often then, like, what's your like best recommendation for the minimum amount of time for women that are busy and have different things going on? Like what's one thing that they can bring in that will kind of cover those pieces?
Like in regard to one exercise? Or?
Yes. Yeah.
Yeah. So even just like getting into stretching or like expanding, you know, really kind of just as you go by a mirror, looking to see that the holes of your ears are over your shoulders are over your hips, and your hips are over your knees, and just really being aware that you don't have your neck either jutted forward or your lower back with like a huge curve or like in it.
So if we're doing all the right things, if you're eating well, you're hydrating, there's movement in your life, and still the pain isn't shifting, what would be the next step?
That would be a great time to come see a naturopathic doctor, or to go to a chiro or an acupuncturist, or get a massage, because it's so important. Is we actually want to see our doctors before it gets to a final like painful stage. And if we can do work when it's just starting out, it's a lot easier to make those habits and changes. And that's before the pain has really started and we're able to actually kind of eliminate some of that. And some of it is just like, getting your muscles. So massage is great for like relieving any tight muscles, because a lot of women, we carry it a lot through the shoulders, and our shoulders start to go up or they start to go forward, and so does our head. And that puts a lot more strain on the shoulders as well. So if you come see me as a naturopathic doctor, we can do a postural assessment. We can do adjustments if necessary, just to structurally align how the body is. And some of it is, we actually just do some soft tissue work to just get those muscles to release or to activate, depending on where the injury or where the pain is. And it may not even be pain at that point. But that's what we're trying to avoid.
Yeah, absolutely. So if you were to summarize, what would be your top 3 things that everyone can do to maybe become aware of the pain cycle, or aware that something might be moving into that cycle, so that they can catch it before?
Yeah. So if you're feeling any stiffness, or you're just kind of feeling like there's a little or ache or pain, it may just be that one day, but that's like that starting cycle. It's our body giving us those warning signs that it doesn't usually just give out on us. It gives us those warning signs. So it's being able to listen to those. My suggestions would be keeping movement of any kind, because if we're moving, we're keeping things loose, we're lubricating joints and ligaments, we're keeping muscles hydrated, and also good circulation. Nutrition is another huge one. Having good quality nutrition so that the cells are able to repair and make the changes that are necessary, and also decrease inflammation. And I guess I'll keep hydration in that as well. And then just making sure that if there is any aches or pains, to get them checked out quickly, not just on the physical level, but that also includes seeing a naturopathic doctor for if there's any food sensitivities or hormone dysregulation, how your sleep and your stress are. All of those factors play an impact on the body, both for injury and for pain.
Yeah, and I think that's the most important piece, like recognizing when there's, even when there's pain, and it might be localized pain, it's connected to something else. Like nothing in our body works on its own. There's always synergy, there's connection, there's systems working together to provide a signal. So it's like what you said in the beginning, it might be a little bit of stiffness, it might be a little ache somewhere, but it's a starting signal to give us an indication that there's something going off. There's something in our balance that's not helping or helping us thrive. So we need to create change now. And that could be as simple as changing what we're eating or how we're moving, how much we're hydrating, and what we're doing all that with, or what emotions we're letting in. So I love that you piece that together, because it's, yes, it could be pain and we can do an adjustment to help shift that, but what's the underlying foundation?
Absolutely. And it's really, that's what I love about naturopathic medicine, is really getting to the root cause of the symptom and treating the whole body. It's not just one isolated event or thing. There's usually some other factor.
So where can everybody find you so that they can talk to you?
Yeah, absolutely. So I have a Facebook and Instagram page, and you can find that at Dr. Heather ND, and doctor spelt out, so DOCTOR, Heather ND. And I also have a website, and it's www.drheathernd.com.
Amazing.
Yeah, and doctor spelt out there too.
Perfect. So yeah, if you have questions about pain, or if you have questions about general health and like how you can build up your resilience and foundation when it comes to posture, pain, any of these things that you may be dealing with, and most of us really are, reach out to Dr. Heather, and I'm sure she'll be able to take care of you. So thank you.
Thank you.